We are recording.
Okay, the time is 6 p.m. on February 4th, 2021, and I would like to call this meeting of the Growth Management Oversight Commission to order. In the interest of public's health and safety and pursuant to the Governor's Executive Order N2920, members of the Growth Management Oversight Commission and staff are participating in this meeting by teleconference. In accordance with the executive order, the public may view this meeting online, but not in conference room. The city launched a virtual commenting portal, e-comment, that allows residents to comment and participate in the meeting from their own homes. You can find the link to e-comment at www.chulavistaca.gov/virtual meetings. Your comments must be received before I call for the closing of the commenting period in order to be considered. After the commenting period is closed, I will announce a brief pause to allow the commissioners time to read any comments that have been received. If you have any difficulty or need assistance with e-comments during the meeting, please reach out to Claudia Ramos at cramos@chulavistaca.gov. Would the secretary please call the roll?
Yes, Commissioner Alatorre, Commissioner Cadillo, Commissioner Juarez, Commissioner Lengyel,
Here.
Commissioner Strong, Commissioner Torres,
Here.
and Chair Hooker.
The first order of business is the consent calendar. I will now call for a 2-minute pause to allow the public to submit any final comments on the consent calendar. Commissioners, as a reminder, please refresh your screen to ensure new comments appear. Okay, the commenting period for this item is now closed. Did we receive any comments, Claudia?
No, I did not receive any comments.
Okay. Do commissioners wish to put any item on the agenda for discussion or questions? Okay, is there a motion to approve the item on the consent calendar?
Is Commissioner Langell move to approve the consent calendar?
Okay, is there a second?
Yeah, I'll move to approve. You're talking about the minutes, right?
Correct.
Yeah, I'll move to approve.
Okay, I have a motion by Commissioner Langell and a second by Commissioner Torres. Will the secretary now please do a roll call?
Yes. Commissioner Alatorre, how do you vote?
Yes.
Commissioner Juarez just logged on. How do you vote? Okay, we'll come back to her. Commissioner Langell?
Yes.
Commissioner Strong is not here. Commissioner Torres?
Aye.
And Chair Hooker?
Yes. Okay, the minutes are approved. The public comments is a section on the agenda for members of the public to address the board on items that are not listed on the agenda. I will now call for a 2-minute pause to allow the public to submit any final comments. Commissioners, as a reminder, please refresh your screen to ensure new comments appear. Go ahead, put the timer on.
One second. Okay, lost connection with someone that was assisting me with that. 1 second, please.
Okay. The comment period for the public comments is now closed. Did we get any comments, Claudia?
No, we didn't receive any comments.
Okay, thank you. The next item on the agenda is item number 2. Kim?
Yes, sir. Thank you, Chair Hooker. Tonight is going to conclude the presentations that we are getting from our topic experts regarding the comprehensive review. We're going to be looking at emergency preparedness, which is under the topic of public safety. And we're fortunate to have Mr. Marlon King here this evening. He is the city's emergency services coordinator. He's been working a lot of overtime over the last 10 plus months through the COVID crisis, on top of all of his other duties. And tonight he's going to give us a presentation on the program and give us some updated statistics on what's going on with the pandemic. So thank you for being here, Marlon. And I'd just like to encourage all the commissioners to turn their cameras on if you feel comfortable, especially when we are in dialogue. Thank you.
All right. Oh, yeah, I'm on unmute. Yep. Okay. Good evening, everyone. Or can you hear me?
Yes.
Okay, perfect. Good evening, everybody. Pleasure to be here. As Kim stated, my name is Marlon King. I'm the Emergency Services Coordinator for the city. I've been with the city 5 years now. Prior to that, I was working with the County of San Diego in a very similar position. At the county, I was one of probably 8 emergency services coordinators here at the city. It's a single role position, so a lot more responsibility under my belt here within the city. As the emergency services coordinator, I oversee the emergency management program, which is designed to basically coordinate all of the city's efforts in regards to large-scale emergencies. That's planning for large-scale emergencies, responding to large-scale emergencies, and ultimately the recovery after a large-scale emergency. COVID has been unprecedented, as you've heard. Many people say never in my lifetime thought I'd come across another global pandemic, especially here in the United States. But in my naivete, we've certainly adapted well here at the city in responding to it, and with the help of all city departments, I would say that we've managed the incident fairly well. Obviously, there's opportunities and lessons learned for future responses. Doesn't have to be as large scale of a response as this, but just we take these lessons learned moving forward and can apply them to any incident that we respond to as city officials. So tonight I'm going to cover basically what the emergency management program entails, and kind of delve in a little bit into the things that we do to prepare our community, and then how we respond, and then what we do in recovery. And I'll give examples, mainly COVID related examples, since we've been at that for almost a year now. So please feel free to ask questions at any time, and then we're certainly interested in the dialogue and feedback from this committee. So if you give me a second here, I will figure out how to share my screen. So again, I'm the emergency services coordinator responsible for overseeing the city's emergency management program. And that's everything from preparedness all the way through the spectrum to recovery. So a little bit about the emergency management program. In the state of California, we have what we call the Emergency Services Act, and that basically authorizes local jurisdictions to prepare bodies or programs or whatever you want to call it. It makes these, or it authorizes local jurisdictions to designate a group of individuals, an individual, collective body, whatever you may have it, to prepare emergency plans that the city is going to use in response to any emergency. So this is Chapter 7 of the California Government Code. And basically it says that a disaster council in the city of Chula Vista is responsible for ensuring these plans are developed, everybody's aware, make sure that folks are aware of them and that they're carried out. So from that, in our municipal code, in Chapter 2, the Emergency Organization Department is developed, and what that sole responsibility of that is. And when we say Emergency Organization Department, it's not a specific city department, but it's individuals that are tasked with basically being part of this collective, this group, to ensure that during any emergency we are focused on protecting persons and property within the city of Chula Vista. And before we go into protecting those individuals, it starts with preparedness. What things are we doing to get individuals prepared? Our city employees, what are we doing to prepare them to respond to these emergencies? How are we preparing the public and knowing what hazards they face and what they can do to protect themselves and their families and their communities? And then leads all the way into mitigation. How can we prevent or lessen the damage from any type of emergency? Then all the way obviously to response, what we're doing during times of crisis, and then recovery, how do we come out of it? So your emergency management program runs the entire spectrum. So it's a comprehensive program. This is a term that you'll hear when you think about any program. You want it to be comprehensive, covering all areas. So these are the areas that we focus on when we speak about the emergency management program. Again, planning, preparedness, mitigation, training, exercise, response, and then ultimately recovery. So when we talk about planning, in all emergencies are handled at the lowest level possible. So that's why we think of local government. And when you think of emergency, it could be your regular day-to-day emergency. Someone calls 911 and they need an officer, or they need a paramedic, or they need the fire department. Those incidents, although emergencies, aren't large-scale emergencies, so there isn't much citywide planning that needs to go into that. Those are mainly department level public safety emergencies. However, all of those have to be basically planned for, right? They happen at the lowest level. As long as the officer on the scene, or the paramedic, or the fire department can handle that emergency, there's no further coordination that needs to occur. Outside of that, then comes your next level of coordination, which would be coordinating with the county, which is a lot of what we're doing currently during this COVID pandemic. Following that, you move up the ladder and you coordinate with the region, which would be the Southern California region. And then if an emergency continues to expand outside of the resources capable by those entities, you move into the state, and then you move into the federal government. So there's levels that each emergency progresses through in order to meet the demands or meet the response needs of the emergency. And when we talk about planning, that's exactly what we're planning for. Plan to handle the emergency at the lowest possible level, and then scale up as necessary. So what you're looking at here on your screen, there are rules and regulations that require that each jurisdiction have plans and policies in place for how they're going to manage these emergencies. One such plan is the Emergency Operations Plan, EOP. That is your most standard plan for any jurisdiction. It's a requirement here in the state of California and across the nation. And FEMA, the federal government, provides a template or recommendation for things that should be included in this plan. Emergency Operations Plan, or EOPs, are all hazards, meaning it's broad enough to speak how emergencies or response is going to be coordinated. It doesn't get to the specifics of you will have this type of fire hose, and your police department will have these type of weapons, or you will set up these type of evacuation routes. It talks about if and when these things are necessary, this is how it's going to be coordinated, so that your EOP can be applied to any hazard. Secondly, there are plans such as hazard mitigation plans, meaning identifying the hazards that are within your jurisdiction, right? Us in Chula Vista do not have the same hazards that would be in, let's say, Carlsbad, or we may not have the same hazards that would be in like a Ramona. Each jurisdiction is a little bit different, and we have to plan for the hazards that are most likely within our communities. And knowing what those hazards are is just one step. and then how do we mitigate or lessen the impact of if and when those hazards do occur? How do we ensure that wildfires don't grow uncontrollably or spread uncontrollably? How do we ensure that floods don't do more damage, or earthquakes don't do more damage than they should? Tsunami is another one that we face. Although it may not be widely known, there is a small tsunami threat here in the city of Chula Vista. And then some of the other plans that you see there, it's all about developing these and ensuring we are accounting for any hazards that we may face or any situations that we may face. Make sure our staff is trained in those and how to respond. That goes not only to our staff, but make sure our communities are aware, coordinate with external partners, which is a lot of what we do as well, to ensure the most effective and efficient response to any emergency. So that's what kind of delves into the mutual aid agreements that we talk about. Standard operating procedures are simply more at the department level of how personnel or specific positions or functions are going to carry out their role. That's more down into the weeds of, hey, this person at this classification, this position is responsible for these activities. This is his checklist or position checklist, basically, kind of in that next level for me as an individual. How am I contributing to the success of this response? Next slide. So when we talk about preparedness and mitigation, that is the next thing. So those plans help us to be prepared. And then we get into the mitigation of things where it's one, preparedness is how prepared are we to execute these plans. When you draft up these plans, these emergency response plans, you put in there things like the type of resources, equipment, personnel that you will need. Well, you drafted this plan. Now, in order to execute it, you have to go out and procure the things that are necessary to implement the plan. So one of preparedness is resource procurement, using our grant dollars allocated to the city annually, whether it's through the state of California or from the federal government. There are grants for emergency preparedness, emergency management programs, and we purchase resources necessary to facilitate our emergency response. And the next part of preparedness is public education. Again, ensuring our communities understand what they need to do to protect themselves. A lot of public education centers around personal preparedness, having a emergency kit, knowing how you're going to evacuate your home, knowing what supplies you need in your emergency kit, having a contact list for during emergencies, things of that nature. How are you personally preparing to keep yourself safe? One, if there's an emergency in your area, if you have to evacuate, if you have loss of power, loss of water, things of that nature. There aren't enough responders in the city or resources in the city to individually care for each of our residents. So it's a give and take as preparedness goes. Preparedness starts at the individual level, and then government can come in to assist as the situation evolves. But when it's first starting, responders aren't going to be on your doorstep at a moment's notice. All right, it's going to take time to escalate to that level. So there are resources that our public can obtain and that we promote so that they can use for their individual preparedness. The next part is community preparedness, focusing on offering resources to the community. How are we helping them train? What are we informing them about as far as things that are in their community? The east side of the city looks a lot different than the west side of the city. The hazards in the east are different than, say, the hazards in the west. The east side of the city does not have to worry about a tsunami threat or much of an earthquake threat. It's more of a west side of the city thing. The east side has to worry more about wildfires. So there's each part of the community or each part of our city has a different worry. So we need to ensure that we're preparing those communities for things that are going to affect them. That's why we have a CERT team, and I'll speak more about our CERT team in a little while. But CERT stands for Community Emergency Response Team, where members of our community can join this team, or even not even join, just be trained by our CERT team to help better prepare themselves in the neighborhoods that they live in. And then we talk about mitigation, and that is what are we doing as a city to lessen the impacts of the hazards that we're likely to face. Many of our mitigation activities focused on two of our more prevalent hazards, which are wildfires and floods. So we want to do a lot of brush management in our canes and open space areas, and then we want to figure out what our nuisance or what our most flood prone areas are, and take corrective actions, whether it's raising the grade in a certain area so that we don't have flooding there. It's making sure our drains and culverts can handle the amount of water that we receive every year. When we get heavy rainstorms, there's a lot of times where we have certain areas of the city that we know are just prone to flooding, and it's going to happen. So how can we prevent that moving forward? So when we talk about local hazards, again, I stated that's what's identified in our hazard mitigation plan. We have a lot of city employees that have been here lots of years, and they have that institutional knowledge of what hazards affect us most. And then some of it is just common sense. We know we have a lot of open space areas, which is why wildfire is one of our top hazards. If you think all the way back to 2003, 2007, when we had those fires on the east side of the city, fortunately we had the big lake out there that prevented those fires from coming over the hillside and jumping the lake into our communities. But wildfire is a very real threat, not only because of our wildland urban interface out on the east. We have wildland urban interface kind of center city. If you think about right off of H Street and Rice Canyon and all of the canyons that we use for recreation, those are wildland areas. We built our city around wildland areas, so we do have that threat here in our city with 30 plus open space areas. And you see that from time to time when we have these fires, brush fires that pop up, or whether it's fires from homeless encampments. Those can turn into very real wildfire threats for our community. So we have to ensure that we're taking steps to lessen the impacts of those fires. Earthquake is another one. Again, we typically don't think about earthquake too much unless it happens, right? And we're saying, oh, we're in Chula Vista and we don't have faults. Obviously, everyone knows about the Rose Canyon fault, but that one runs through the city of San Diego, and they say, oh no, it's not going to affect the city of Chula Vista. But the fact is that the Rose Canyon fault, there will be liquefaction down into the South Bay City. Studies have shown that Chula Vista will be, although not, you won't get a lot of structural or home damage from that, just from the amount of ground shaking, we will see liquefaction in our areas. So we have to know that the La Nacion fault is a real threat as well. You can see, obviously, there's the Rose Canyon there in the green, in orange. However, you look here on the map, you see that La Nacion fault. Although many people think it's inactive, it is an active fault and can potentially cause damage here within our city. So a lot less is known or stated about the La Nacion, just because it's not as popular as the Rose Canyon, but it's still a very real threat here in our community. So then others, flooding. I don't know if you guys remember back in 2017 when we had the big winter storms. Our city was really impacted in January. We had over 800 trees fall, and apartment fires, people displaced from their homes, things like that. We also had a dam spillover, and it did what it's supposed to do, right? The lower Otay Dam spilled over, and that was doing exactly what it was designed for. It spilled into the river valley, and the water just ran, and eventually, if it was enough spillover, that water would have just created a river right out to the Pacific Ocean. But if that dam did break, like it did back in 1917, then there would be a real big issue down on the southern part and then the western part of our city. So that's a very real threat, is the flooding threat here in our community. And then obviously I mentioned the tsunami threat. We are considered a coastal city with the San Diego Bay right there. So if there was a significant earthquake event that generated a tsunami, we do have plans in place, notification protocols for that. But everyone isn't as educated, and especially with this Bayfront coming online, it may be more worth educating our community that there is a tsunami threat at our Bayfront, although low, right? It's very low. Uh, we can't turn a blind eye to it because the threat is there. So we do all that planning and preparing and the mitigation efforts. That's all well and good, and then we have to focus on, well, putting these things into reality, right? We have to practice and exercise the plans we put in place. We never know if it's going to work unless we exercise it. We never know if our communications are going to work until it actually happens. And when you put a plan together, and as soon as you press save, obviously that plan is outdated because things are going to change. Nothing ever is going to work the way you put it down on the paper. So we always have to continue to be flexible. That's why we want to try to do as much training as possible so we can adapt on the fly when the moment comes. Part of our training and exercise is our Emergency Operations Center. So the Emergency Management Program is responsible for this Emergency Operations Center. When you think EOC, just think of a big room, and you can kind of see it there in the picture, the top picture there. It's a room filled with people, various roles, responsibilities as city employees, but everybody bringing their expertise together to ensure the response is coordinated and carried out efficiently. What you're looking at there is the operations section of the EOC, but you have various pods. There's probably about 4 other pods in that room that are all focused on a different aspect of the response, but each of their functions or focus areas come together for a bigger plan to address all facets of the emergency response. So this is a large part of what we do. This is actually what we're doing now currently in COVID, continually monitoring, assessing the situation, and responding as necessary, adapting to the ever-changing environment. We set goals and objectives, we have policies, and we figure out what actions are necessary to meet those objectives. You see other trainings up there, such as shelter training. Obviously, if we have a large-scale emergency and we need sheltering, we want to make sure that we have that ability for our residents. Oftentimes, we lean on the Red Cross. They are our primary shelter provider. However, if there's an emergency countywide, then Red Cross may not have the staff to open a shelter in our jurisdiction, and that rests on us. Now we have to use our employees to open a shelter. So we want to ensure that we have that capacity or that capability here in the city. One of the other things I said I would talk about is our CERT team. That is the Community Emergency Response Team. Again, it's volunteer based, but we have a great group of volunteers that lead our CERT program, and it's really designed to help members of the community be a part of something, or at least gain training from that group. You can be a CERT member and receive a higher degree of training, such as search and rescue and other things. But you can also just be a community member and say, I want to be trained so that I can assist, or I can help my neighbor if there's an emergency in my immediate area. Trainings that the CERT team provides: stop the bleed, learning how to put a tourniquet on for a mass casualty event, run, hide, fight, teaching you what to do if you are in an active shooter situation. FAME is another one that they put on. FAME is first aid meters and extinguishers, so learning how to do basic first aid, learning how to turn off your utility meters in the event maybe an earthquake and you need to shut off the gas or anything water, shut it off. And then extinguishers, teaching people how to use a fire extinguisher correctly. So there are various trainings that our CERT team offers just for the general community, basically to educate them in disaster preparedness and being effective during an emergency. And then one that you see that is most common is our emergency public information. That's one of the biggest things that we focus on now, and obviously here in the time of COVID, information is key. The information changes so quickly. This is one of the incidents where I've seen the minute that you put something out, it almost changes immediately. And that's how it was from the beginning. Not much was understood about COVID, And every day it seemed like somebody was identifying something new, and new information had to be put out. So how are we educating or communicating to our public the information that they need to protect themselves, to stay safe, and also what we, the city, what actions we need our public to take. So emergency public information is and will always be huge, because people need information in order to respond appropriately. So the big thing is response. So how do we respond, and what is required of our response? So again, emergency management is all about coordination, bringing the right players to the table, bringing the right resources to the table to ensure that we're the most effective and efficient or thorough in our response. Uh, so our emergency operations center, I mentioned those 4 pods, those 5 pods of groups of people that are focused on responding. They're identifying what needs to be done and how we're going to do it. What's our priority? What needs to be accomplished first? So we again are focused on supporting our field operations, and that's again getting the resources that they need. If they need another fire truck, where are we getting that from? If they need a water tender, if they need light towers, if we need cots, if we need whatever, it's how are we supporting them in the field? They're our eyes on the ground, and they can tell us what they're seeing, and we can plan accordingly or respond accordingly. All of this needs funding. Who are we going to get funding? How are we coordinating with the county, with FEMA, with other funding sources? And then obviously information and intelligence. Uh, what can we glean from anybody in the public? We're scouring social media, just anywhere where we can get information or get intel from that can help drive our response. And then obviously we mentioned the public information and warning. We mentioned how crucial that is, getting information out to the public. Stay out of this area, evacuate this area, close your windows. There's so many things that we have to get out to the public. If you think in the time of COVID, it was uh, wash your hands. First thing was wash your hands, but you don't need a mask. Now you need a mask. Wear a mask. Then it was stay away from others, or stay indoors, telework. Uh, it just changed. It changed so rapidly, and we have to get that information out as much as possible. So what are we doing during our response that is going to ensure the safety of our community? And nothing is off limits. We have to be prepared to respond in various ways, and COVID has proved that there are drastic measures that we need to take in order to ensure our protection. And emergency proclamations, the next thing on the list, does just that. We proclaim emergencies when we realize that this thing is going to escalate and drastic measures will need to be taken. Proclaiming an emergency in your city allows us to make these judgment calls and basically implement rules, ordinances, laws, if you have it, that are for the good of our community and protecting life and property. And then lastly, again, that coordination with external partners, which proves so crucial during any incident. We're not going to be able to accomplish anything on our own. So in times like downtime before COVID, we want to ensure that we have those relationships, those agreements with agencies like the County of San Diego, with the state of California, have our contacts at FEMA or Red Cross, or with our community groups and nonprofit groups, because so many people are gonna step up to the plate and be partners during any emergency response. So a little bit about the COVID-19 response. So here's kind of how things play out in real life, right? If you think back to March, if you think about it, Chula Vista was kind of the epicenter, if you want to call it that, in San Diego County for COVID-19 response. Back in end of February, early March, it was reported that a employee from an AT&T store here in Chula Vista was one of the first persons in San Diego County with COVID-19. Again, at that time, it was the message around COVID was that it's not there's no community spread. It's not a real threat to individuals in our community, and everybody kind of downplayed it, and we took the word for it, and we should, right? They're public health professionals, they're scientists. They had no reason to believe that COVID was here in San Diego County. All right, so that was just kind of a one-off, but it was an eye-opener that, hey, before COVID wasn't here, and then all of a sudden we're getting reported that there's one case in Chula Vista, and then a couple weeks pass, and then you start hearing more and more of these singular cases pop up across the county, and then eventually on March 13th there was a emergency proclamation because I think on the 11th one of our council members came down with COVID-19. So we realized it was a very real thing, and it had hit home. So what were we doing at that point to ensure uh, that we were protecting not only our employees here at the workplace, but our community? How were we getting that information out? And we had to take drastic measures. We were one of the first cities in San Diego County to proclaim a local emergency. We were one of the first cities in San Diego County to mandate or put an ordinance in that masks will be worn here in the city of Chula Vista. We were one of the first cities to close our operations here at City Hall while we reassessed who should be at work, who shouldn't. We were one of the first cities to close some of our public spaces, parks, libraries, things of that nature. So again, as you learn more and more about an incident, it changes your response. It changes the things that you're doing to protect your community. And we don't, as a local government, and most smaller cities, I should say, don't have public health professionals, which is why we rely on the County of San Diego public health officer to provide us the information that we need to have in order to make educated decisions about our response. So you can see there, our COVID-19 response began with coordinating with the county public health. When we had that AT&T store case, we had an immediate conference call with the AT&T store employees, our city management, and the county public health officer to talk about how real is this and what things do we need to be doing. And based off that conversation, we took specific actions. And then as more cases were identified, we took additional action. So it's assess the situation and implement a strategy, right? And as that strategy is implemented, you monitor its effectiveness, and different things need to happen. So as we ramped up, at first it was putting out hand washing stations and portable restrooms because we closed our facilities. Well, how is our most vulnerable population, our homeless population, going to practice the good hygiene that was being promoted? We needed them to wash their hands, so we have to insert hand washing stations all throughout the community. The next thing was masking. We made it a mandatory masking thing. How are we getting that message out? How are we getting masks to people that may not be able to get masks? So we had basically a masking campaign, walking up and down the west side of Chula Vista, handing out masks, going to the business districts when we said that stores need to have mandate that their customers wear masks. So we go out to those business districts and give masks to those stores so that they can hand them to their customers as they patronize their stores. So again, assess the situation and then take action on what is needed. The next thing was distancing. So again, closing our facilities or the facilities that stayed open, ensuring that we adhere to the social distancing rules. Testing was a big one when it first came about, and we realized that the South Bay was being hit the hardest. What actions were we as a city taking to ensure that we made it accessible to our residents? We were one of the first cities to coordinate with the counties to bring a large testing center here. Our first one was at the old Sears facility, which is still there, but that's a partnership between us, the County of San Diego, and the state of California, bringing testing to Chula Vista. Again, we saw that was a need. Testing was ever important. And if you remember, testing started out low, and then we had a big surge in the testing that was occurring. We subsequently added more testing facilities because we knew that one wasn't enough. There weren't enough appointments at that location. So we brought on Aquatica, the testing site down at Aquatica, another county partnership. We committed our city staff, our city dollars, to the testing site at the Chula Vista Library, which was unheard of. No other jurisdictions in the county were doing that. Again, This is our EOC, our policy group, our coordination from all city departments coming together, lending their expertise to identify needs and identify solutions to address those needs. And then obviously vaccination. In coordination again, partnership with the county, with some of our private sector partners using that Sears facility as a super station here in the South Bay. And then eventually we'll be moving to mobile vaccinations, things of that nature. So it's always, our response is always fluid, and we always adapt to the needs that are out there in the community. So our response, obviously, you have to tailor it to your needs. You have to understand the community's unmet needs and ensure that we're doing everything that we can to reach that. More so, there are a lot of other things in our response that played as well. The feeding component, the kind of checking on individuals as they're in their homes. They are working with our businesses that had to be closed, and it's impacting them, and they may go out of business. How can we get creative and ensure that they have resources, tools available to them to help them navigate this pandemic and navigate the public health order that was so drastically affecting them. So it's not only about kind of the life safety and protecting public health and safety, it's also being a good neighbor and helping those in our jurisdiction that could use our assistance. And we as a city had to be flexible, had to be creative and adapt to ensure that we're providing for the needs of everyone, not just the human needs, but there's the business needs, there's the social or behavioral needs. Again, working with all city departments to they all have contacts with various members of the community, and we need to understand those needs and then address them as best we can. So as it relates to our COVID response, just a little bit about kind of our statistics and where we stand. What you're looking at here is the case rate in Chula Vista, and you see it there on the right side of the screen as 106.1. It's one of the higher case rates. We're in the South Bay, and as we all know, COVID has hit our South Bay communities the hardest. But positive news is that these numbers are trending in the right direction. Case rate is starting to go down. Testing positivity percentage starting to go down. The hospitalizations on a downward trend. The ICU admissions on a downward trend. So all of these numbers are headed in the right direction. Though we have a long way to go, right? These numbers going on the downward trend, coupled with the testing ramping up as quickly as possible, this is the perfect recipe, perfect combination to get us through this pandemic. So we're through our winter surge, and now we just have to hold steady, hold the line, and inch forward as much as possible until we can get an adequate supply of vaccine to push us over that finish line. So as it relates to testing and vaccination, again, both of these efforts we're pushing here in the city. Our testing site that we, the city, opened in October. Since then, we've conducted over 40,000 tests. And here's another thing about adapting. When we first opened it, it was a non-appointment test site, meaning we wanted to open a location that was for the community and met their needs, meaning a lot of people don't have access to the internet or things like that. They couldn't make an appointment. Well, it was non-appointment. Come and we will make the appointment for you right there on site and service you. It was on Sundays, offered Sundays through Thursdays. There was no other locations open on Sundays. We were the only location to open on a Sunday, and we were very popular not only for the South Bay but for members coming from other places. So we identified that gap and ensured that we had testing in our community 7 days a week. Whether it was at Aquatica, Sears, or our location, library location, you could get testing 7 days per week. From there, that testing started ramping up, and it got very, very popular. The no appointment lines were wrapped around city blocks. Waits were upwards of 5 hours. At some point, that's no longer sustainable. It's no longer efficient, and it becomes a problem to the members of that general community where we have our testing site. We're blocking driveways, we're disrupting businesses, things of that nature. So what could we do to mitigate that? Well, we could make it an appointment site, right? Offer more appointments, ultimately see more people, because we're not spending the time registering them anymore. They're just coming in, checking in, and getting tested. You're coming at your given appointment time, which you're not waiting 3, 4, 5 hours for a test, or yeah, 3, 4, 5 hours for a test. And then we're also not disrupting the community. It's no longer a traffic hazard. We're not blocking people in their apartments. We're not disrupting the businesses that are in the area. So as it got more popular, we had to make this transition to appointments in order to, one, be good neighbors, be more efficient and effective, and then three, offer more to our community. So again, offering 900 appointments a day now, there's plenty of space available for those that are seeking testing. And then obviously as it comes to vaccination, we want to roll this out and make this as big as possible, but we can only do so as the supply comes in. So we have a vaccination super station that's open 7 days per week, and so far we've conducted over 26,000 tests. Things at this site have been going very well, aside from the fact that it's very tough to make an appointment. But it's tough to make an appointment simply because there's not a lot of vaccine, right? There are 3.3 million people in this county. There are 200 and let's call it 75,000 here in Chula Vista alone. There is not that much vaccine that is coming down to the South Bay. There's not that much vaccine that's coming to the county in general. So we just have to be flexible and be patient just a little longer until we can get the resources that we need to roll this vaccine out as big as possible. And then the last part goes into recovery. So what happens after a disaster or an emergency? What are we doing to get back to normal? Well, I can tell you this honestly. I don't know what recovery after COVID looks like, just because it hasn't been seen before. But we have a long road. I imagine it's going to be mass still for a long time. It's going to be smaller crowds in a lot of our spaces, whether it's at our parks, whether it's inside of our recreation centers, in our libraries, even at our work sites. I can see flex schedules, things of that nature happening. So it's going to have to. Recovery is just going to be a slow progression, and that's just recovery kind of on the human side. Internally for the city, what does it look like? Well, it's trying to recover all of our costs for everything, all the funding that has been spent on the various protective measures for COVID-19, the testing, those personnel hours, those resources, all that stuff comes at a cost to the city's budget, unanticipated cost to the city's budget. So how can we make sure that we make ourselves whole again, so that we can continue providing great services to our community? We don't want to cut park hours or recreation hours or library hours. We don't want to cut city staff and not have the personnel needed to run all city services. We want to get back to a level, get back whole and even better than before. Also part of recovery is connecting residents to available public services, right? With the federal government and reimbursement, there's public assistance, which is for governments to recoup those monies that I talked about, and then there's individual assistance. Will there be any individual assistance? Obviously, stimulus is a thing being debated at the federal government level, but is there any type of other individual assistance that we can offer to our communities? So recovery again is after the disaster, how are we making everyone whole again, getting them back to a place where they can continue with their lives as it was pre-disaster. So that really covers kind of the high level of how we engage in emergency response, or what we're responsible for in emergency management. But again, it's preparing our communities as best possible, and then responding in the most efficient and effective way, and then restoring our communities and making them whole again after an emergency. So I thank you for your time, and I look forward to more discussion.
All right, thank you, Marlon. A couple of questions from me before I up to their commissioners. So the services you have, the vaccine and the testing side, are those for Chula Vista residents only, or are those for county residents? And how do you track that?
So the services that we're offering as far as vaccine and uh, testing, it is for all county residents. There's no tracking, so to speak, for uh, who's coming to the site, right? We don't differentiate, or we don't turn anyone away. The services are for everyone. Now, when they either register for a test or you register for a vaccine, right, there's information or data that we have to collect, right? You have to be entered into a system, and one of those is address, right? So you're either providing your zip code or your address, and that's how kind of that data is tracked for the most part. There's no verifying, I guess, so to speak, is if the address that you're putting is your actual address. But it's all data that is collected, and it's not so much used here at the city level. It's more of a county thing, because they are the ones that are helping provide the testing or vaccination resources, meaning the tests or the vaccines. The county is the one that has paid for that, or the government has paid for that. So we don't use that data to say, hey, we vaccinated this many Chula Vista residents. It's we vaccinated this, or we vaccinated or we've tested this many people. Now, what percentage of that are South Bay or Chula Vista residents, I could not tell you.
Okay. And then, so when you mentioned recouping some of the funds expended as with the testing site, so are you looking at the county to recoup that money, or how the state? How what's the thought process on that?
Yeah, so reimbursement is going to be through FEMA on that.
Okay.
So there's two ways, and specifically speaking for our testing site, that reimbursement will be through FEMA. FEMA uh, FEMA reimbursement. That's called public assistance, and they have various categories of public assistance. One of the categories is Category B. Category B is emergency protective measures. During an incident, there are certain emergency protective measures that every city is likely to do or must do in order to provide for the public safety. So a pandemic, testing is very important, right? That's how you're going to protect your community. You can't protect them if people don't know that they're sick, or that the relative that is sick. You have to provide them this so that it educates them and they can help protect themselves. So this is a protective measure that needed to be implemented. So that is a cost. Whatever it costs to implement that is recoverable through FEMA. Basically, so a testing site will be a project, right? We're seeking reimbursement for this project. This project is testing. Testing was done for these specific reasons. FEMA will say, yes, that meets the need. What did you need to do that project? Well, we needed gloves, we needed masks, we needed gowns, we needed swabs, we needed this, we needed that. All of that, just keep track of how much all that stuff costs. Keep track of the personnel, keep your receipts, etc., etc. You turn that package into FEMA, they'll review it, and then they'll authorize it, and whatever that bill comes out to be, they will reimburse you. Typically, it's a 75-25 cost share. FEMA will typically pay for 75% of it, and then your jurisdiction is responsible for the other 25. But a memo was just released that FEMA will pay 100%, which is never happened before. FEMA will pay 100% for certain emergency protective measures. Now, they haven't said which ones, but I can see testing and vaccination being two emergency protective measures that will be paid for 100%.
Okay. And my last question is so since the South Bay, our area was hit with a high positive rate with the vaccine, are we getting more, or with testing, are we getting more vaccine because we were at that higher rate, or how is that being distributed countywide?
Unfortunately, I do not know the answer to that question. I know that our supervisors, all the South Bay mayors, obviously, and then our supervisor for our district, Nora Vargas. Everyone is aware of the inequities here that we've had in the South Bay. Now, in those meetings that they have supervisors and the persons that are responsible for how the vaccines are being distributed, I don't know if they are setting aside a greater percentage to come to the South Bay. I would assume that they are. If you look at the map of locations where they've set up vaccination locations, you can see that a cluster of them are focused in the South Bay area. Obviously, we have our superstation, but then you have other smaller community clinics and medical facilities that are also doing vaccines. So a greater concentration of those vaccination locations are here in the South Bay.
Okay, thank you. Any other commissioners have some questions?
Yeah, this is Commissioner Alatorre. I'd like to make a question.
Go ahead.
So, Marlon, my question is more of a concern as far as emergency preparedness and management moving down the line, not only with COVID, but with other disasters that might affect our city. So what COVID has shown us is that no matter how hard we try to prepare for something, there's always things that pop up that are unexpected. In this case, for example, trying to obtain PPE for the hospitals, for the first liners, for everyone that needs it in general, and not only for them, but also for the citizens of the city. Can you elaborate a little bit if the city is working with businesses or working with entities in particular to try to bring those resources here to the city? For example, I was astonished to find out that like 80% of all gloves, latex gloves, are made in Indonesia or in Asia somewhere. As an example, are we trying to bring those businesses here to the city so we can try to be a little bit more self-sustainable in our needs, not only with COVID, but per se, like wildfires, bringing businesses that deal with fire extinguishers, generators, in case of earthquakes and things like that. Can you elaborate on that for me, please?
You know what, that is a great question, and at this time I don't know that we are actively recruiting or inviting those businesses to set up shop here in the city. I think it's a great recommendation. I would have to refer that over to our economic development department, who kind of focuses on what type of businesses are we're recruiting to come set up shop here in the city. I do know that we're doing what we can to kind of procure or secure resources for future incidents, like our PPE supply. We're trying to keep a 6 to 9 month supply on hand here in our city warehouses. For fire incidents, we are trying to basically bring in more resources that we use to respond to fire, whether it's water tenders, whether it's bulldozers, things of that nature. So for every incident, we're trying to secure as many resources as we think would be necessary to help us be self-sufficient when responding. Any incident it's likely going to exceed, or any great incident is going to exceed our capabilities. That's why those mutual aid agreements with other jurisdictions are so imperative. But as far as bringing businesses here to the city, I have not heard that those discussions are taking place, but it is a great recommendation to see if we can invite some of those businesses to look and set up shop here. Being in the South Bay, especially southern San Diego, I mean, it would we're like the cul-de-sac, right? Where they always call us the cul-de-sac. We're at the bottom. Stuff funnels down. It comes down from the state, has to go through Santa Barbara County, has to go through LA County, has to go through Orange County before it reaches San Diego County. So it's almost like we're always the last ones to be thought of. And the idea is that we need to do everything we can to be self-sufficient. So I think you're right on target. Can we bring in businesses that we can have here in our backyard that we can rely on?
And Kim and Kimberly, is that something that you can go to city staff and see if that's been a thought?
Certainly, we can talk to economic development.
Yeah, because that's a great idea. That really is.
And
Okay,
it also has to be. I mean, when we talk about it, it's easy for us as a city to go out and pitch and recruit and try to bring them here. And obviously, and in my opinion, they likely be successful because they're going to serve other cities like City of San Diego. We'll have the cities to the east of us. So there is opportunity for them here down in the South Bay. But it's whether or not they sign on to do it.
right. Commissioner Torres, do you have a question?
Yeah, I have a couple questions. One, on the CRT training, how many participants have there been that have received CRT training by the city?
So we have currently we have 50 active CERT members, and when we say active, that means when we send out a request for CERT activation, they're either responsive in signing up or saying, "Oh, they're not available this time," or they've activated for some incident within the last year. So again, 50 active CERT members. There are about 133 inactive, and that's, I would say, inactive because I think our threshold is somewhere between 2 and 3 years since they became a CERT member. And then I cannot tell you how many we've had go through the program since its inception. So right now, I would just stick with our 50 active members. So it's a volunteer base of about 50.
Is that training provided in both English and Spanish?
Yeah, so there's Spanish CERT, and then obviously there's CERT, which is, I guess we just call it regular CERT. There is it's about a 4-week training to become a CERT member, right? That's go through the courses that are designed to teach you in being a CERT member. And then again, that's offered in English and Spanish. Obviously, there was no CERT trainings offered in 2020 simply because of COVID. I don't know that we'll be offering any this year simply for city policy. We're not able to hold those trainings in person, and a lot of that stuff is hands-on in order to be a CERT member. The other trainings, such as just the I call them single trainings, such as the CPR, first aid, stop the bleed. Those are just one-off trainings. I don't know how many people have been trained in that. I would have to get you those numbers. But again,
That's all right. I just wanted to get a general idea. Now, with regard to COVID, one is I actually got 2 tests at the Chula Vista Library over on Orange, and it was really efficiently done. But to answer Commissioner Hooker's question, those that are being targeted now are 65 and older, if you remember, because everything comes from the state to the counties, and initially the vaccination, the rollout was so hodgepodge and was done differently county to county, and it became such a mess because in San Diego County, if you remember, they were actually giving out vaccinations to firefighters as part of the first responder strategy. But now it's 65 and older, okay, is right now. And then also, too, they're talking about the federal government distributing the vaccines directly to drugstores, Walgreens, CVS. We're talking 100 million doses within the next 3 months. So bypassing the governments and going directly to the private sector. But with regard to COVID, I have to say that ever since March, when we were all ensnared in the coronavirus pandemic, I was actually very pleasantly surprised by the compliance of residents and businesses in Chula Vista with regard to wearing masks. And so I want to applaud you on that because somehow, some way, the word got out, and you saw signs everywhere, mask required for service, and as opposed to, say, Encinitas, Carlsbad, other cities in Northern County, where there was a lot of resistance, non-compliance, and in Chula Vista, I've seen a tremendous amount of compliance. So I want to applaud you on that effort. But the question I have is this. is that up to now, what you have done has been exemplary. However, as is being reported, vaccinations are going to take quite a bit of time. Okay, even with the rollout of Johnson Johnson right now seeking emergency approval from the FDA. So even if we have 4 vaccines, it's going to be taking a long time before the United States, and I'm focusing now on South Bay, to acquire what's called herd immunity. Okay, so has the city, as part of its COVID planning, anticipated what our new reality will be or should be in this uh, evolving transition toward herd immunity? And even if we get herd immunity, as being reported by the federal government, we're still going to have to wear masks. We're still going to have to social distance. We're still going to have to do a lot of things that we're doing now because COVID will be with us for many, many years. Okay. And we'll probably require a booster shot every year, like flu shots, right? So, my question then, and I don't want to pontificate, is emergency, your department, thinking long term how to deal with this evolution about how COVID is going to be affecting our businesses, our schools, our neighborhoods?
Yeah, I would say we are. So that's our advanced planning, kind of looking down the road
Right.
as to what some of this fallout is going to be, what it's going to look like in the summer, what is it going to look like next winter. And I completely agree. We're going to be wearing masks. That's going to be a city policy for quite some time. We've kind of been in lockstep with the county as far as what our restrictions will be. What I'm afraid is that as things start to get better and the county starts to open up,
Right.
we will have to be more restrictive here in the city, and that may not go over as well, right? If the county starts opening, right, it's the public health officer's orders, and they say, okay, rec centers can be open. Well, we don't feel that comfortable here in the city of Chula Vista. Our rec centers are going to stay closed. Uh,
Mhm.
what does that look like for our city? What does that look like for our residents? Because they could just go next door to National
Mhm.
City. They could just go next door to the city of San Diego and use the facilities there, right? So we kind of have to. It's good. There's going to be some give and take. There's going to be a lot of discussion around us continuing. I think we've always been, but us continuing to be more restrictive if the county does indeed start to pull back on some of their restrictions.
Okay, because the one particular concern that I have, and if you've been reading the news or reading the papers, watching the news, is about Biden's um, impetus to get schools open within 100 days. And
Mm-hmm.
this has become a major flashpoint in California. And Governor Newsom has received a lot of pushback on that. And now with the teachers' unions and everything else, also pushing back hard. Now, my concern, and I hope that the city of Chula Vista, your department in particular, is working with the schools, with Sweetwater Unified and Chula Vista Elementary, about how to coordinate all that, because when those schools open, okay, despite CDC studies to the contrary about transmission of the coronavirus by our young, um, it's going to have a major boomerang effect in the community with regard to potential community spread.
Certainly.
So I hope you're working with them in that regard.
Yeah, there are people in my position at both the Sweetwater Unified High School District and then the Chula Vista Elementary School District, and I'm in conversation with those folks a few times monthly as
Okay.
to what their plans are as far as reopening, and I know they're planning for that, but like you mentioned, the teachers unions and all that stuff, that is. They have a long road to go as
Yeah.
far as getting everyone in agreement as to when they should open. I know they
Okay.
do, I know they do have plans as far as the social distancing and flex schedules for the students. keeping them in small cohorts, so doing everything that they can to be as safe as possible. But just as a parent, I know it's almost necessary for students to have that face-to-face interaction with their teachers. This online learning.
You know where I'm coming from as far as planning, coordination,
Yeah,
and blah,
certainly,
blah, blah. Okay.
certainly.
All right. Thank you.
All right, any other commissioners have questions? Okay, well, Marlon, thank you very much. That was very informative.
Yeah, thank you guys, and I'm always available. Please feel free to reach out anytime. Email mking@chulavistaca.gov, or always feel free to call or shoot me an email, or if you reach out through your city contacts, both Kims, they know how to get a hold of me. And again, we're in this together, and we want to ensure that we're providing for the needs of our residents. And if there's something that we have a blind spot for, please let us know so that we can correct that and get everyone the resources or information that they need.
Thank you very much.
Thank
Okay, I
you.
will now call for a 2-minute pause to allow the public to submit any final questions on the item before the commission. As a reminder, please refresh your screen to ensure new comments appear. Okay, the comment period is now closed. Did we get any comments, Claudia?
No, I didn't receive any comments.
Okay, thank you. The next item on the agenda is number 3, Planning Commission input. Kimberly Elliott.
Yes, thank you, Chairman Hooker. As you know, last Wednesday, I mentioned I was planning to meet with the Planning Commission, as we had promised, to give them an overview of all the work that we've done here to date on the comprehensive review. And then the following night, on Thursday, was the joint meeting of the GMOC, City Council, and Planning Commission. So you heard a little more input there as well. But I thought I'd just report out what City Council and Planning Commission said. So I got the sense that both entities thought we were generally on the right track and liked the direction we were going. And I made it clear to the Plan Commission that we had made no decisions yet, that this was all still preliminary. And I walked through the schedule with them. And just a couple comments they made. They particularly liked that we had added economic development to the list of topics, and would particularly like to see employment and job growth numbers as part of that. and expressed their interest in the whole jobs housing balance idea. They'd also like to see fiscal added back as a topic, so we can look at the fiscal health of the city. I had originally thought we could take that out because the last few years it's just been a regurgitation of the city budget, but I think there's definitely some good metrics around that we could add fiscal back in. They thought sustainability was also a good topic, and we're happy to see that. Under housing, it was suggested that we look at the RENA numbers annually and see how we're doing against those. And that's a report that Leilani does every year. So we were definitely thinking that would be a good thing to look at. One of the council members, you all were there, mentioned that she would like to see us look into how much state funding the city gets. And just in noodling on that after the meeting, we were thinking we might be able to look into like a per capita state funding number. So we'll do some research on that. And then also with regard to the state, someone else suggested that we look at how any new state regulations influence the city's quality of life. Planning Commission Gutierrez referred us to the county's Live Well program. And Kim and I have done some research on that, and we met with Commissioner Gutierrez this morning, and the Live Well program falls under his responsibilities, and City of Chula Vista is a Live Well partner. So we found there's just a wealth of data in that program, and Kim and I will continue to meet with the staff at the county to learn more about their statistics and the different things they're looking at.
Can you explain what that is?
So I wonder if I could show it. So they have the Live Well vision came out of a statistic that 57% of the county were dying from 3 diseases, which were all based on choices people made: smoking, diabetes, and heart disease. And so they created programs or vision of how to solve those. And it's expanded further beyond health, but community safety. Looking for my notes. Let's see. So their 3 main topics are health, safety, and thriving. And so they look at things that we've talked about from the Healthy Chula Vista group, like food, availability of food, and Kim, what are some of the other examples?
Well, if I could just maybe give a little overview of what the areas of influence in the 10 indicators are.
That'd be great.
Okay, so there's 5 areas of influence: health, knowledge, standard of living, community, and social. And then there's a couple of indicators under each one. Under health, there's life expectancy and quality of life. Knowledge, there's education. Standard of living, there's unemployment rate and income. Community, there's security, physical environment, and built environment. And social has vulnerable populations and community involvement. So the nice thing is they have a dashboard on their website, and it's updated regularly, similar to how our police department updates their dashboard with statistics on these various topics. And we think that those perhaps could be beneficial as we move forward with some revisions to our program.
And they're collecting it for Chula Vista specifically, plus other counties, state
Yeah,
cities?
they break it down by county. I mean by city, sorry.
Okay.
Mhm.
Okay, that makes sense.
Yeah, Kim, thank you very much. So we're excited about that there is some data readily available, and we're going to work with the county staff to look into that some more.
One comment on the financial piece that you mentioned.
Sure.
One thing that caught my ear during the joint workshop was the mayor seemed surprised that how low the city funded libraries. And that kind of surprised me because we've been pinging on that for, since I've been on the commission. I don't know if we're not clear enough with what the issue is, the amount that City of Chula Vista puts in per versus what other cities put into libraries. So that kind of surprised me. But, as part of the financial, if we could break down how the city funds from the general fund to each of these items that we're going to track. So like, the police funding is X amount, fire department's X amount, libraries X amount, roads are X amount, public works are X amount, and not really look at the financial from this is the revenue we received, this is how much we spent, this is how much we got. It's more, how's that money being spent throughout? Because one thing that I kind of concerned was when the mayor brought up that, it seemed like they were surprised that libraries were underfunded. And then I think one of the other councilwomen brought up about, how can we get other money that the libraries used? And I wanted to say, well, we brought that up last year, and the response was they couldn't take the money that they were getting out of the passport office and put it back in the library because it goes in the general fund. So it seemed like a mismatch there that they didn't understand. So
Can I interject, Commissioner Hooker?
Yeah, go ahead.
That's not what I picked up from Mayor Casillas, is that what I picked up from her, along the lines of what you're saying, yeah, she wanted to know the funding stream. Yes, she wanted to know the funding stream. What monies are going into supporting library services, okay? But what she, because I took copious notes, is that what she wanted the focus of this commission is not to be on the square footage issue, which it
Right.
has been, predominantly concerned. She wanted to know services. She wanted the focus to be on the service levels provided by the library. And are those sufficient, say, for example, comparable to other cities? Because, and if not, why not? And how do we make it better? How do we maximize the services based on, like you're pointing out, the limited funding devoted to library? Because what you're talking about, Commissioner Hooker, that's already in the annual financial, the annual budget that the city releases, which is approved every year by the city council, is clearly delineated in the worksheets how much money, general fund and otherwise, goes to each department, what the revenue streams are, their budget, their expenditures, yada, yada. So I don't think the GMOC should regurgitate that, but rather address what she was talking about, which was what are the funding streams, the focus on services, not square footage, because the bottom line is that, let's be honest, and she talked about it, a library at El Del Rey, for the most part, is never going to happen. Okay.
Right.
So if that's not going to happen, then how do we look at library services from a different paradigm? So it's going to require a paradigm shift. Okay. So that was, and I hate to interject, but that's what I got.
No, and I agree with you there. I think what got me off guard is they seem surprised at those numbers, and my thing is to show the gap, and really to emphasize the gap that Chula Vista is spending a lot less on libraries, not really from the square footage area, but overall funding for libraries is lower in Chula Vista than it does in other cities in our county.
Yeah, that's fair.
But okay, Kim, that's about.
Thank you. So just to summarize, the Planning Commission also encouraged us to meet and talk with the other commissions as we've discussed and you've all suggested, and also to make sure we're getting community input as well. And I just want to be clear that we really always planned to do that, but wanted to get some more meat on the bones here and have you guys have more deliberation until we engage with the community. So if I could, Claudia, if I could share, you could share the screen, however that works. Okay, and okay, can you see that?
Yep.
Okay. Oops, shoot, there we go. So this is the schedule that I presented to Planning Commission and again at the City Council meeting. So just a reminder that tonight is our last night, as Kim mentioned, to hear from the subject matter experts. And then now Kim and I are going to go back, discuss with management, have just spend more time on all the topics and the indicators that we want to look at and bring something back to you. I'm hoping we can do that in April and then spend time on this, April, May, June with you all and also other stakeholders. And then hopefully we'll be ready by Planning Commission City Council approval in August. So that's our goal.
So are you thinking the public review in the June timeframe?
That's what I'm thinking, but we'll doodle on that as well.
And how would that be done, I guess? Would that be this type of meeting, or would that be a special?
It could be a special meeting. I know on different topics where they've needed public input, like the housing element and I think there's been some park and rec design work that they want community input on. They've set up special meetings like this with WebEx where the community can hear the presentation and weigh in. So we'll work on that as well as how we will do that with the public. Okay, how do I unshare here, Claudia?
This is Kim. I just got a text from Claudia. Her computer shut down and she's logging back on.
Okay, all right. Sorry. Let's see. Okay, so just in closing for my remarks, I just really want to thank you all for your time. This has been, I know there's been a lot more meetings than you usually have, and we really appreciate your time. And I think we've gathered a lot of information and learned a lot together. And we got some good feedback from Planning Commission and Council. So I'm looking forward to working on this with Kim and coming back with something more substantial for you to chew on.
Okay. Commissioner Torres, did you have any other input from
thank you
the
for
Planning Commission that you were there?
Yeah, thank you for asking me, Commissioner Hooker. Kimberly covered it quite a bit, but there's one thing that we did talk about the Planning Commission, and I don't know how that's going to be addressed, but Commissioner De La Rosa, he actually talked about it at the joint meeting, is how does the new GMOC ordinance interface with other development related ordinances? And that's going to be a tricky thing to deal with, because he wanted that to be addressed as the Planning Commission evaluates prospective projects. So because, you know, and that's actually something I talked about with Commissioner Carrillo months ago, is how does the GMOC ordinance interface with what we do on the Planning Commission? But also too is that you heard Council Member Galvez talk about this, and I thought this was a profound question, and I think this is something that the GMOC really needs to think about, because we're talking about quality of life. And she brought the issue about economic, social, and environmental justice. Because remember, you know, because that's a whole different paradigm, okay? It's a different way of looking at things as opposed to the way that GMOC has in years past, much more, and I don't mean this derisively, but more like a widget, you know, looking at things like from a widget perspective, as opposed to these types of vantage points. So that's something I think we really need to look at, because again, as I opined, you know, when we were talking about the police, you know, we live in a post George Floyd world, and we can't be evaluating the police department solely on response times. We have to look at public safety from a different vantage point. So other than that, I think Kimberly pretty much hit on it. I'm only concerned, as Commissioner De La Rosa was, is about engaging the other city advisory committees and commissions, that process, that timeline, and how do we feed their input through the GMOC? So I'll leave that to staff to figure out. That's definitely, I think you heard it from the Planning Commission. There was a particular concern about that. They want to make sure that other stakeholders are involved. All that input is funneled through the GMOC, and then at the proper point, it comes back to Planning Commission before it goes back to the City Council. But other than that, I think everybody's doing a great job.
Okay, great. Any other commissioners have comments or questions? No? Anything else, Kim or Kimberly?
Nothing for me. Thank you.
Okay, so I will now call for a 2-minute pause to allow for public to submit any final comments on the item before the commission. As a reminder, please refresh your screen view to ensure new comments appear. Okay, the comment period for this item is now closed. Did we get any comments, Claudia?
No comments received.
Thank you. Okay, we'll now move on to other business. Staff comments.
I don't have anything else.
Nothing from me either.
Okay. Claudia, anything from you?
No, nothing from me. Thank you.
Okay, I have no other comments. Commissioners, anyone else have comments?
Yes, this is Commissioner Alatar. I just have a comment.
Go ahead.
So in light of all the work that's been done in the past year and the timeline that was set up by Kim, I know personally it takes me some time to really digest and then regurgitate all the information. So my comment was, if within the next couple of weeks or so, anybody on the commission has some ideas, who should we shoot that to directly? Would that be to Kim Vanderbeek?
So you mean in terms of potential new topics?
Yeah, the topics we talked about, I just feel that a lot of the topics are kind of just like bullet points that need a little bit more meat on them.
Yeah.
And I know I've kind of gone through some of them myself and had some ideas that I would just like to kind of elaborate on that. But I'm not sure it's appropriate to really put it out there before it's reviewed by the staff.
Yeah, definitely. If you have some comments, please send it to Kim, Elliot, myself, and Claudia, the three of us, and not to any of the other commissioners. And then we will review it and see how to potentially distribute it at a future meeting.
Okay, perfect.
Does that sound good, Kim? Yeah, she's nodding.
Yeah. Yes, that sounds good.
Okay.
You know the protocol better than I do on that type of.
Yeah, no Brown Act violations.
Yeah, exactly.
Okay, anybody else have any questions or comments, commissioners? Okay, it is 7:41 p.m. and I'll adjourn this meeting. Our next meeting will be February 18th. Is that true?
No meeting.
Okay. So our next meeting will be in April.
Yes.
Or
We'll
TBD.
give you plenty of notice
Okay.
on that.
Okay. Thank you, everybody. Take care.
Thank you.
You too.
Bye.
Good night.